it's CJ. Welcome to week 27 of your pregnancy. Today we're going to talk about what's happening with your tiny human, some of the more common symptoms that you might be having, what you can do to alleviate those symptoms, and what symptoms are not okay. And if you stick around, I will give you all the information on how to deal with restless leg syndrome. So at this point, your tiny human is now roughly the same length as a cucumber, measuring right around 14.4 inches or 36.6 centimeters from the top of their head to the bottom of their feet. And he or she now weighs somewhere between 2 and 2.6 pounds, which is roughly 900 to 1,200 grams. This week, your baby's brain, nervous system, and lungs are all continuing to mature. Your little one can now detect light, and if you want to try something fun, shine a flashlight on your tummy and see if you can't get that tiny human to wiggle a little bit. Here's the good news. If you were to deliver this week and you have access to excellent neonatal care, your baby now has a 94% chance to survive. So here are some of the more common symptoms that you might be having, what you can do to alleviate them, and when you should be concerned. Number 1, your fundal height. The top of your uterus is now measuring between 25 and 29 centimeters from the top of your pubic bone. If you have an OB visit this week and you're measuring smaller or bigger than you should, your provider will most likely order a growth scan to make sure everything's okay. Number 2, mild swelling in your hands and your feet, especially if you're on your feet all day. I recommend putting fresh lemon in your water. Avoid extra salt intake. And if your feet are swollen, try putting them up or even wear compression stockings. When should you be concerned? If your swelling has a sudden onset, is severe, or if your face is swollen. Number 3, you might be leaking urine. You sneeze, you laugh, you cough, you tinkle a little bit. That's really common, especially if you're over the age of 35, obese, or if you have a history of a vaginal delivery. However, it's not something you have to do. If it is a problem for you, I recommend talking to your provider. Make sure you don't have a urinary tract infection and even consider starting pelvic floor physical therapy. Number 4, symphysis pubis dysfunction, also known as pelvic girdle pain. That is being caused by the hormone relaxin that's being produced by your placenta. I recommend using a pregnancy support belt. Sleep with a thick pillow between your knees at night. You can try putting ice on that pubic bone. Taking pain medications is recommended by your OB provider. And that's another case that pelvic floor physical therapy might very well come in handy. Number 5, some cramps, twinges, and that round ligament pain. If you're having cramping, I recommend emptying your bladder, get off of your feet, and drink 32 ounces or a liter of water and monitor. If those cramps do not go away, if you're leaking fluid or having vaginal bleeding, please contact your provider right away. If round ligament pain is an issue, I recommend making sure you're doing some stretching exercises during the day. And if you know you're going to sneeze, cough, or laugh, splint or hold onto your tummy. And finally, number 6, restless leg syndrome. That affects about 20% of pregnant women. Usually happens in the 3rd trimester. It's believed to be caused by hormone changes or low iron. Unfortunately, there is no test for it and there is no medication that has been proven effective for treating restless legs. If you are struggling with restless legs, I recommend the following. Number 1, talk to your provider. They may want to check to make sure that you do not have anemia. Number 2, avoid caffeine or tobacco products. Those can actually make your symptoms worse. Number 3, try to get regular exercise, including stretching exercises such as prenatal yoga, every single day. Number 4, try taking a nice warm shower or a bath right before you go to bed. Number 5, try to establish a sleep routine. Go to bed and get up at the same time every single day, and avoid looking at your phone while you're in bed. Number 6, relaxation techniques such as breathing exercises or distraction like reading a good book. I hope that this information has been helpful, and if you have any questions, you'll leave those for me in the comment section below. And while you're in that comment section, I sure would appreciate it if you'd hit the like button or even feel free to share this video. Hello, it's CJ. Thank you so much for watching the entire video. I truly do hope that the information has been helpful. When I make these videos, it is not meant to replace a visit with your healthcare provider. Rather, my hope is after watching my video, you know what questions to ask your provider at your next visit to best meet your own healthcare needs. In the meantime, if there's any questions that I can answer, I hope you'll reach out to me. And finally, if you have not already subscribed to my channel, I'd really appreciate it if you did that. That's all I have for today. This is CJ, and I am at your cervix.